Hello, ladies and gentlemen. Welcome to Triple N Media Talk Show. I am Dr. NIK NIKAM. You are watching COVID-19 World Pandemic. The focus today is on pathogenesis of COVID-19. It is a very complex process. Let's try to get a better understanding of what is going on inside the lungs and elsewhere in the body to cause such devastating changes in patients who are critically ill with COVID-19 infection. This COVID-19, which started in the first week of January in Wuhan, China, has expanded to more than 200 countries and it has infected 2.7 million plus people all across the globe, resulting in 771,000 plus deaths. Have 14.5 million people having recovered from this coronavirus pandemic. You look at the magnitude of the pandemic, which is still in its first cycle of the pandemic spread. In some countries, it has not even reached the peak of this cycle. For example, India. If you look at the United States data, we have more than 5.5 million people who have tested positive for the coronavirus, with 173,000 deaths almost. And as we can see here, we had an initial spike, then it was coming down, and somewhere in June it had a second spike, reached up to 75,000 cases per day. Then it has gradually come down to approximately 50,000 cases per day. Even though there has been a dramatic drop in the number of deaths related to COVID-19 infection, nonetheless, those people who are admitted to the intensive care unit still carry a pretty high mortality in the range of 40 to 75%, and it goes up much higher in patients with hypertension, heart disease, diabetes, and kidney problem. To that, you can add obesity also. In fact, COVID has been recognized more and more in children below the age of 18. But in this presentation, we're going to focus on the pathogenesis of the most severe complications of COVID-19, namely coagulation abnormalities, inflammatory responses, and cytokine storm or cytokine response. So let us focus on these changes happening inside not only lungs but all across the body, and we will learn a great deal about this here. The coronavirus enters through the upper airways and it goes through the airway system into the alveoli or the air sacs, in which there are what are called the epithelial cells that line these air pockets where oxygen and carbon dioxide are exchanged. And it is on these cells, the so-called alveolar epithelial cells. There are two kinds of cells. These cells have what are known as the ACE2 receptors, that is angiotensin converting enzyme receptors. These are the receptors used by the angiotensin, renin-angiotensin cascade system. However, the COVID-19 virus or the SARS-CoV-2 uses the same receptors to get into the lung cells. It is aided by certain proteases that help to bring this virus inside the cell and cleavage its capsule, thus releasing the RNA genetic stream, which stimulates the host cell, namely the epithelial cell or the endothelial cells, as we'll see in a few minutes, to replicate these chains of RNA. And these multiple chains of RNA, each one of them represent a new viron molecule. To that, the spike protein and the membrane proteins are assembled in the reticular endothelium, and finally these RNA chains and the membrane and the spike proteins are transported to the Golgi apparatus, where they are finally composed into a full viron or unit of virus, which is then expelled into the lungs, and some of it gets expelled into the mainstream circulation. More recently, there has been a lot of research done on not only the effect of this coronavirus on the epithelial cells that line the lung alveoli, but they also have found out that these coronaviruses affect the ACE2 receptors located on the endothelial cells, and thus cause the same kind of damage to the endothelial cells as they do the damage for the epithelial cells. But in the process, not only do they use the resources of the epithelial cells to replicate themselves, and in the process, they set off a number of signals, namely cellular signals, to suppress the T cells, to minimize the immune response from the T cells, along with humoral responses like stimulation of bradykinin and cytokine, things like that, which will eventually lead to the destruction of this cellular material itself, which will be cleared by the lymphocytes and macrophages, resulting in a debris inside the lung tissue. Let's look at here. And as you can see, when these epithelial cells are attacked, so here's the epithelial cell lining the alveoli, and here we have the capillary, which is, and then we have the membrane separating the epithelial cells and the endothelial cells. Anyway, so the SARS-CoV-2 attacks the epithelial cells. It leads to hyaline membrane formation. There is a thickening of the interstitium, and there is release of monocytes and neutrophils, all of which fill up the air spaces as fluid and as gelatinous material, which is very hard to get rid of. Coming back to what I was talking about, the endothelial cells. As you know, the endothelial cells also have these ACE2 receptors. The endothelial cells line the entire vascular system, which explains when the endothelial cells are affected, they are not just affecting the lungs, but they are going to be affecting all the other organs like heart, liver, kidney, muscles, and peripheral vascular structures, leading to tiny gangrenes. Let's look at some more effect of these. Let's look at what happens in a composite manner in a alveolar sac once they have been attacked by the coronavirus. Here's a normal alveolar sac which is filled with air. There's no debris. The epithelial lining is intact. But look at here. The epithelial cells are partly destroyed. There is release of all these cytokine elements like interleukin 1, interleukin 6, 8, along with tissue necrosis factor. And also there is a hyaline membrane formation. All of this lead to edema and inflammation, which fills up these air spaces, leading to pulmonary congestion and pneumonia, which you see on the X-ray and on CAT scans. Along with that, we have the endothelial layer, which is also disrupted, and because of the destruction of the endothelial cells, which have these ACE2 receptors, there is the exposure of the basement membrane of the arterial system, which is highly thrombogenic. It results in formation of it results in coagulation cascade in addition to causing inflammation. Let's look at proposed mechanism of coagulation initiation. As I was telling you, when there is involvement of the endothelial cells by the COVID-19 virus, by attaching itself to the endothelial ACE2 receptors, it exposes the basement membrane, which activates the coagulation cascade. That leads to microthrombi. Microthrombi lead to the reduction of circulation. When there is reduction of circulation, we get microinfarcts. These microinfarcts attract more leukocytes and monophages, resulting in inflammation, reduction in the circulation, and release of all these immunological elements, which leads to further worsening of the overall condition. There is also platelet production and platelet aggregation along with this activation of fibrinogen. There's also tissue factor release. All of these are procoagulants which lead to activation of the coagulation system within these microvascular structures, leading to microemboli, reduction of blood circulation, tissue necrosis beyond the obstruction, and inflammation, and all of this become a vicious cycle. Similarly, now let's talk about cytokine storm. How does the cytokine storm develop in these patients? We talked about the coagulation side of the COVID-2 virus effects from acting on the endothelial ACE2 receptors. When these cells are activated, both in the lungs, in the epithelial cells, and also in the endothelial cells elsewhere in the body, be it in the heart, in the kidneys, in the liver, or even in brain, they release these vasoactive molecules, namely interleukin 6, 8, tissue necrosis factor, thrombin, histamine, bradykinin, thromboxane, and as you know, thromboxane, and a lot of these are highly procoagulative elements. They lead to thrombosis, and at the same time, these cytotoxic elements are toxic to the system. A combination of reduced circulation, tissue necrosis, and the chemical effects, the humoral effects of these cytokines eventually leads to sepsis, leads to shock, renal failure, respiratory failure, which is a culmination of this cytokine storm. There's also these factors, interleukin and tissue necrosis, which acts upon glucuronidase, leads to degradation of glycocalyx, which also leads to the formation of hyaluronic acid. Then this hyaluronic acid, which is sort of hyaline, which accumulates in the air spaces or in the capillaries, leading to obstruction. The proposed mechanism of inflammation, I already touched on it, because of the destruction of the epithelial cells in the alveoli and the endothelial cells inside the vascular system, which is about 60,000 miles long. There is release of all these complements, cytokine toxic elements, bradykinin, thromboxane, and also there is amplification of these cytokine toxins, which I talked about. All these lead to inflammation. When there is tissue necrosis, there is infiltration of macrophages, lymphocytes, and all of these further make the condition worse. So the pathology is not confined to the alveolar epithelial cells. Now there is more and more evidence that the involvement of the endothelial cells, the virus gets into the cell through the ACE2 receptors and cause the same kind of damage to the endothelial cells as they do to the epithelial cells in the lungs, and in the process they are self-destroyed, namely the epithelial cells and the endothelial cells, which leads to cellular toxins which block the ability of the T lymphocytes to produce immune response, at the same time attract these macrophages and lymphocytes, resulting in inflammation along with tissue necrosis because of microthrombosis. It can involve the lungs, which are the most commonly affected organs. It can also involve the heart, which can lead to myocardial infarction, cardiac arrhythmias, and death. It can also involve kidney, leading to acute kidney failure. It can involve liver, and occasionally it can also involve the brain, resulting in microinfarcts, stroke, and It also can involve the peripheral arterial circulation leading to gangrene. So these are some of the features which we are going to be seeing in far advanced cases of critical patients in the intensive care unit when they have this sudden surge of the cytokine along with microthrombosis going all across the system that can lead eventually to the death. So, ladies and gentlemen, this is in a brief nutshell the entire pathogenesis of the lungs and also the vascular system, which indirectly affects the brain, the heart, kidneys, and liver. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel. Also, we have more than 30 videos, educational videos on the topic of COVID-19. So please do visit our COVID-19 playlist and watch those other videos. And please do subscribe to our YouTube channel. This is Dr. NIKAM. Thank you.